Welcome to this explainer. Today, we're decoding a deeply frustrating medical mystery, intractable dizziness. You know, if you've been told you just have to live with a world that constantly feels like it's spinning or dragging, well, you're in exactly the right place. We're going to figure this out together. It's a question so many people ask, right? Why won't this dizziness just go away? This is incredibly common for middle-aged women who are frequently, and honestly, quite unfairly, told it's just menopause. But struggling just to stand up? That isn't something you should ever brush off. There is almost always a distinct, hidden medical reason behind it. In the medical world, we actually have a specific name for this condition: intractable dizziness. Basically, if you've had sudden or constant dizzy spells that just stick around for 3 months or more, even after trying some initial treatments, you fit the bill. This isn't just standing up too fast, it's a chronic, debilitating disruption to your everyday life. To get you some real answers, here is our roadmap for today. First, the mystery of chronic dizziness. Second, decoding Meniere's disease. Third, unmasking vestibular migraine. Fourth, spotting the key differences. Fifth, pathways to lasting relief. And finally, number 6, your diagnostic toolkit. Let's jump right in. Starting with part 1, the mystery of chronic dizziness. What's absolutely fascinating here is the true demographic of this condition. It doesn't just spike around middle age. It strikes the earnest 20-something at a stressful new job, or a 70-year-old weighed down by the really intense demands of caregiving. If you are a methodical, deeply responsible perfectionist, your body absorbs that stress, and sometimes it quite literally knocks you right off balance. Which brings us to a really powerful realization. It is a massive mistake to just assume all fluctuating dizziness is simply due to menopause. If a doctor dismisses you without taking a deep dive into your specific symptoms, they are likely missing the root cause. Because your symptoms, they require some serious detective work. Let's move to part 2. Decoding Meniere's disease. So Meniere's has a very specific MO. Doctors actually call it the triad. It hits you with violent rotational dizziness, but it never comes alone. It brings tinnitus, that annoying ringing in the ear, along with hearing loss. And here's the absolute key. It is highly localized. You have right ear Meniere's or left ear Meniere's. The ear symptoms and the dizziness are a total package deal. Now, time is your best clue here. A Meniere's attack usually lasts anywhere from 10 minutes to a few hours. Once it clears up, it's gone for the time being. It doesn't just last for a mere 3 seconds, and it definitely doesn't drag on for days at a time. The clock simply doesn't lie. Thanks to modern MRI technology, we can actually look right inside the ear now. The biological cause is called endolymphatic hydrops, which is basically a water blister sitting right inside your inner ear. When intense stress disrupts your nervous system, your ear's ability to drain fluid breaks down, and that causes this intense, dizzying swelling. I absolutely love how Dr. Fumiaki Goshima frames this. He's a leading expert, and he views the dizziness not as a failure of your body, but as a protective alarm system. It's literally your brain screaming, "Stop, you need to rest right now." If you ignore the alarm, well, the sirens are only going to get louder. That brings us to part 3, unmasking vestibular migraine. Now, this invisible culprit is super tricky because it perfectly mimics Meniere's right down to that exact same earfulness and ringing. But here's the twist. There is no fluid buildup. None. It's completely invisible on an MRI. Instead, it's rooted in a history of migraines, and there's a massive genetic link, often passed right down the female line. And surprisingly, you might not even have a throbbing headache during the dizziness, which is exactly why it evades diagnosis so often. And unlike the clean, hours-long funish of Meniere's, a vestibular migraine is an exhausting marathon. These episodes can drag on for up to 72 hours. It's this lingering, recurring sensation of being entirely off balance, leaving patients stuck in a haze that feels like it's just never going to lift. Let's look at part 4, spotting the key differences. Putting these two side by side reveals some crystal clear demarcations. Notice the contrasts here. Meniere's is a violent spin, while the migraine is more of a dragging wave. Meniere's reps up in hours. The migraine tortures you for days. And crucially, Meniere stems from stress-induced ear fluid, while the migraine is tied to a deeply ingrained genetic neurological sensitivity. Moving into part 5, pathways to lasting relief. For Meniere's disease, you definitely don't jump straight to the operating table. Relief is a step-by-step escalation. You start with basic lifestyle tweaks, getting adequate sleep, hydrating well, and taking 5,000 to 6,000 daily steps to just get that fluid draining. Next up are diuretics to shed water. If that fails, specialized machines can gently massage the eardrum. And only as a very last resort, surgery is used to decompress the fluid sac. But on the flip side, if you're dealing with vestibular migraine, ear massages or surgeries will do absolutely nothing. Why? Because your ear isn't the problem. Your brain's pathways are. This requires specific migraine preventative drugs, and you've got to have patience here. It takes about 2 to 4 weeks for these medications to work their magic and really dial down the attacks. Finally, part 6, your diagnostic toolkit. Since we don't have some magic blood tests for this, your personal history is literally the key to cracking the case. You need to keep a dizziness diary. You'll want to track 3 precise details: the exact duration of the attack, which specific ear felt deaf or full, and the timeline of any headaches. Did the pain come before, during, or after the dizziness? Keeping this diary is a total game changer. It empowers your doctor to look past the surface and make a highly accurate diagnosis. Oh, and please hear me out on this one. Never try to rush to the clinic when the room is actively spinning. It's dangerous, and honestly, it's unnecessary. Your one and only goal during an attack is to rest at home, take your emergency meds, record your symptoms in your diary, and bring that organized evidence to your doctor later when you are totally stable. It's time to stop accepting unexplained or just menopause as your final answer. You now have the knowledge to spot the differences and track the clues for yourself. But it leaves us with a really important question to chew on. How many other invisible conditions are we simply living with just because we haven't tracked the right evidence? It's time to start that diary, reclaim your balance, and thank you so much for joining me on this explainer.